Today, All County Home Health Care, Inc. at 954-717-7027. License 200999096.
The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of the station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to the You and Your Doctor show, Living a Longer and Healthier Life. Tonight we're going to talk a little bit more on the side of case management and how that works as well with our guest this evening. It's going to be Marlene Lieberman, MSW, NHA, CSA, CMC, and I will find out about all those again. Marlene, welcome to the program. How are you doing this evening?
Great. Thank you for having me.
Thank you for coming along. I always say this Adventure Health because we always learn so much from our guests, and that's why we really do this. So I know you do a lot with elder care management, and I am going to get into that topic as well. But just tell us a little bit how you can help the South Florida community. So this show, obviously, it's a lot of baby boomers watching, either on actually Facebook or YouTube or maybe listening, driving around in their car, and the older population. So how can you help the older population in what you do in your organization?
So as a care manager, really helping people as far as hand-holding, being a navigator, being an advocate. So many people don't know where to turn. And so as a care manager, it's really a client-centered, holistic approach where it's a one-stop shop to be able to help people navigate through a very challenging system that we have, to find resources, to coordinate services, and find answers for the things that they often can't find.
And tell everyone the name of your organization.
So the name of my business is called Senior Care Planning. And put a lot of thought into why I named it Senior Care Planning, and it really is for older adults and really planning for their current and planning for their future as well.
What age should seniors start planning? I mean, is this something that should go on in the maybe the working years just before retirement or just at retirement, or is there not really an age?
So I guess the first thing is, what is a senior? And so a lot of times people say, okay, what is a senior? And I think that what I refer to as an older adult, and people should really start planning throughout their life, really, maybe starting in their 50s. There's so many things to plan for. So a lot of times people wait until they're either infirmed or there's a crisis, and at that time it's really not advanced planning. So there are so many things that you can learn along the way even before you actually need it.
It's a good point there, because anything thrown together quickly can sometimes have some hitches. So if you take the time to plan ahead of time, most of the time your outcome is probably going to be better.
Exactly. And sometimes people don't have the opportunity to plan ahead because there are acute illnesses, there are emergencies, and so often that's the time where a care manager is extremely important to get involved with. But, of course, if there's options, planning is always helpful.
And what is your experience here in South Florida working with caregivers or families? They're caring for a loved one. I think the show just before this is about a caregiving show, and I know you've been on it, so
right.
Shout out to Marcia Teal's show there. But I actually listen to that all the time when I drive in, so it's a great show. And I didn't know much about caregiving until I had a family member who had Alzheimer's disease, and I watched the progression there. So that's very important, and the caregiver and the resources that they can find, the family, so important. So what is your experience here in South Florida working with caregivers or families?
So a lot of times people don't understand really who are the caregivers. So there are family members who are caregivers, there are friends who are caregivers, and then there are paid personnel who are caregivers. So whoever they really are the people who provide care. And one of the most important things for caregivers to know, and we've discussed this on Marcia's show as well, is about caregiver burnout and how difficult it is to be a caregiver. Some people, family members, have to quit their jobs because they can't afford to pay for someone to help. And so there are so many community resources for caregivers. There are support groups, which I just started running a support group at Artists Senior Living that's going to be opening in Davie. And support groups are a great place to really be able to meet other people going through similar situations.
And thanks for mentioning that. How can people find out a little bit about that support group in Davie?
So what they can do is they can call Artists Senior Living in Davie and find out about that support group. And there are many others. There's the Alzheimer's Association provides multiple support groups in the community, or for people who are savvy with their computers, they could Google caregiver support groups in whatever county they live in. And they can find a wealth of information about support, or they can call me. And I can help them.
Well, we'd like to give out your phone number a few times during the program. What is the number?
Certainly. So it's 954-806-6035.
Okay, and we'll give that out a few more times. Like I said, we're here with Marlene Lieberman. She is a case manager certified, and she is from Senior Care Planning. A great website that I found a lot of info on. It's seniorcp.com. So you'll find Marlene's info there, the phone number. And I'm glad you mentioned about the support group, because sometimes people will go back to the show because it's on allcountyhealthcare.com's website. Mm-hmm. There's all the shows are there, and maybe they use it as an archive, and if they miss something or they kind of think, oh, I remember Marlene was on that show and she mentioned this or that, and it can help them. Or Facebook. .com as well. All County Healthcare has a page there. If you just type it in the browser, you'll find it. So all the shows are there as well. And I noticed you have a presence on Facebook as well. I looked on there earlier and I liked your page. So there's a lot of great information on there as well. You do a good job with that.
Well, thank you. Thank you.
Definitely kudos. So Marlene, let's talk a little bit about your background, because before I was so excited to have you here this evening, and I kind of was rushing a little through all those acronyms, the MSWs, the NHAs, the CSAs, the CMC. So tell us a little about your background and what these acronyms stand for.
So the MSW is a Master's of Social Work, and the NHA is I am a licensed nursing home administrator. I worked for a community actually for 28 years locally. So started as a social worker and then worked through as an administrator. And the CSA is a certified senior advisor. And the CMC is it's a care manager certified. And so that is a course and an exam and with a lot of criteria in order to be a certified care manager. So that's what all those little acronyms mean. What it really means is that I love what I do and I really care about helping people finding resources and solutions to the needs that they have for their family and loved ones.
And that you've done the education and training to be the source for senior care planning as well. So that's very helpful as well. I know dealing with seniors, resources is very important, and we're going to get to that. I noticed on the website you also had a little bit about advocacy. What is advocacy, and why is it important for seniors?
It is important because so often people don't know how to really advocate for themselves. And so as a professional, it is important that when I have a client, they are number one. And I make sure that they get what they need for their own specific needs. And so advocacy is important because otherwise you kind of get lost in the system and it's very difficult to find your way through. And that is the beauty of coming to one professional to be able to help, because I don't do everything myself. I work with a lot of professionals in the community that I like and trust. And so, for example, I don't give legal advice. I work with elder law attorneys. Home care, just for like all county. So if there's someone that needed home care, I would refer to someone that I liked and trusted. So what I do is coordinate services based on the relationships that I have to advocate for the client.
That's great, and you have the experience in South Florida to help with those choices. And I saw to help with a legal advocate as well, because I know, and you did mention elder law, and that's a very important part of the process. I don't know if everyone thinks about that, when they're doing senior care planning, but that can be a huge piece of the puzzle, right?
Yeah, that is the thing that I find that people are very unprepared with. So the first question that I always ask new clients is, do you have a power of attorney? Do you have a healthcare surrogate? And do you have a living will? And 50% of the time people say, I don't know. And so those are the things that I explore with people, because if you don't have a power of attorney, it is very difficult that if you become unable to really communicate with the medical profession, then there's no one that can ever act on your behalf. And a healthcare decision maker, if you have an accident, become ill and unable to make decisions, you don't have that. There's no one to advocate for you either. So I try to ask all the questions, and sometimes people have very old documents, and those old documents don't comply with what current laws are, and so it's almost like not having anything. So that is why I refer to elder law attorneys for that.
We're here with Marlene Lieberman. She's with Senior Care Planning. The website, a ton of information on there is seniorcp.com, and her number is 954-806-6035. So if someone's listening to the program or viewing it and they have a question about, am I or my loved one am I in the right spot in terms of senior care planning, can you come in and do an assessment or meet with them and kind of get them going in the right direction, take the steps, consult with them, give them the information they need?
Yeah, so that's a great question.
Thank you.
So part of the initial work, what I do with most people is that I will do a professional assessment. Oftentimes people are still in their home and families don't know what is the right decision for their loved one. So I will go to the home and talk about options. There are so many options available. Some of the challenges are financial limitations, location, care needs, and so all of those things need to be considered. But yes, I will do a complete assessment on that. And one of the other things, if people do want to stay in their home, there's so many safety issues involved in people in their home where, you live in your house for 20, 30 years, you don't really see what is there or what the hazards are. So I will do a full safety assessment and make recommendations as well for that in their home.
That's very important, because I know one of the leading causes for seniors to be hospitalized is falls. And that can be just pathways in the house,
Exactly.
It really can. And to have someone licensed and, a professional like yourself come in and take a look at wherever someone's living is very important.
Right.
I noticed you mentioned also coordination of service on the website as well. Does that have to do with more so coordinating all the resources to help the individual or family, and then in turn that may make them healthier because it helps their quality of life by helping them coordinate their services? It's something less the family has to worry about, or the spouse in some cases, or the son or daughter, and you can kind of come in and you have the resources needed, the network, I guess the word would be, to coordinate those services.
Right. And an example of that would be someone who possibly was a little forgetful and they aren't able to manage their doctor appointments. Doctor appointments are very challenging, and when you have multiple doctors. So one of the things that I do is coordinate medical appointments, accompany people to the appointments, and be able to be the voice and the liaison between the client and the physician and the family. And so that's one piece of coordination. Another one is transportation. Another one is health and wellness, and making recommendations to other professionals about how to stay healthy, maybe medication management when people aren't able to manage their own medications. So a lot goes into it.
Fantastic. Marlene, hold that thought. And on the other side, we'll talk to you a little bit more about senior care planning on the Living a Longer and Healthier Life show.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
Hi, I'm Deanna Barron, RN, with All County Healthcare. You know how I know that I've done a good job? We say goodbye. After you understand the medications you take, once you know that gaining 2 pounds in a day means you should call the doctor, when your wound is healed, when you can use your nebulizer all by yourself, when the goals that you and your All County Healthcare team of nurses, therapists, and aides established are met. We say goodbye. Very nice to meet you, and I hope I never see you again. And I mean that in the nicest way possible.
You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hello, South Florida and beyond, and welcome back to the Living a Longer and Healthier Life show. I'm here with Marlene Lieberman. She is care manager certified with senior care planning. So if I did say case manager before, I apologize. Marlene is care manager certified, and it's senior care planning. The website is seniorcp.com, and I'll give that out again before the end. Marlene, I wanted to ask you a little bit. Can you help also with financial and benefits assistance? Because that can be a little tricky, right?
It is. And a lot of times what you find is that all of a sudden the mortgage isn't being paid, and all of a sudden the electric is turned off and the water is not running. And so oftentimes people forget to pay their bills. And one of the things that I'm able to provide clients with is bill pay, getting organized, making sure, reviewing their mail, making sure that their bills are paid so they don't get in that situation. And the other thing you asked was about benefits assistance. There are many people who need financial assistance, and one of the things that comes up often is I get a lot of calls for, I need Medicaid. And Medicaid is very complicated, and people often are misinformed and think that if they run out of money, that they will be eligible for the state program. And so being that I'm not an elder law attorney, I don't give financial advice, but what I can do is review documents and talk to people about what is their current situation and what do they think they need. And then there's where the coordination of services comes in, where I can guide them to speak with someone about financial planning for Medicaid. And I also do file the Medicaid applications for people. One of the things that goes along with that is that what are their care needs? And I get many calls for, well, I don't know if I need a nursing home. I don't know if my loved one needs an assisted living community. So talking about what we did before, that's where the assessment comes in. And I also help relocate people into assisted living and nursing homes based upon their needs and their finances as well.
Well, you're a great resource, and Marlene, it's from Senior Care Planning once again. You seem very organized as a person. Is that true? I mean, definitely. I mean, you have a lot going on, and you've got a great track record, so that must be true. Very organized.
You have to stay very organized when you have multiple clients. And the beauty of it is because I want to make sure that everyone gets what they need. And the only way to accomplish that is to stay organized. And communication is very important. And when looking for a care manager, being able to feel comfortable in talking to the individual, communication, making sure that you get calls back, emails, and that families are up to date all the time. And so, again, that just goes along with personality and the right fit.
Well, you can give Marlene a call at 954-806-6035, or there's some info on seniorcp.com. How did you get involved and become what you are today? How did you get involved in this field?
So, interestingly enough, way back in my college days, I always wanted to be a physical therapist and kind of nixed that because there was too much science. And so I knew that I always wanted to help people and wanted to get a social work degree. But I also had elderly parents, and I had elderly relatives that lived in Florida. And I found myself always finding resources and solutions to help them. And it just became a passion of mine. And so when my parents were aging and at some point not aging well, I found myself always trying to navigate the system and knew that it was very difficult for other people to do it, but I did it really well. I made sure I always went to the top, got things done, knew what I was accomplishing so I could help them. And then over the years decided that, okay, my passion is this is what I want to do. And that's when I started my own business 7 years ago. But always a nursing home administrator, ran an assisted living community, and was always trying to help people have a quality of life with as much independence as possible.
Well, we're thankful that you made this choice because you're bringing a wealth of knowledge on the program this evening, and I can tell that you're the person to contact in senior care management. You mentioned elderly there, and our baby boomers are getting older, and the elderly population is living a little longer as well, which is great. But that means we're going to have more elderly people in this country than ever before. What are some of the warning signs that our elderly parents, the community needs help at home? What are the red flags?
That's a great question too. So there are so many red flags, and especially families who live out of town that only visit intermittently. They may not notice it as much as someone who comes often, and sometimes when you come often, you don't notice it that much either. But warning signs like medications, you see that they're not being taken. Sometimes a true test is if you count the pill bottles and know when they were filled, then you may know whether or not they're taking their medicine. A change in behavior, you may find someone who is getting more confused, leaving dishes, spoiled food in the refrigerator, maybe cleanliness, not combing hair, not taking a shower, little telltale signs. Sometimes even just the forgetfulness. There's normal aging forgetfulness, and then there's sometimes more serious things. Driving. Oftentimes people get lost driving, or they say, oh, I wasn't paying attention. People may have excuses for the things that happen. So those are some of the warning signs that people could be aware of. And those are red flags.
Red flags that it's time to find help.
Time to find help, time to find, yes, someone like a care manager. I find that families often call a lot of different people and only get little bits and pieces of information, which becomes very frustrating.
We only have about a minute and a half left, so I want to, Are you available for all three South Florida counties, Palm Beach, Broward, and Miami-Dade, for helping those counties?
I am available for North Dade, Broward County, and South Palm Beach County.
Okay. That's a great. That's a great area. That's the area I scoot around often.
Yes, I have a lot of miles on my car.
Yeah, I was going to say that's a very busy area. About 4 million people at least just in that area.
And I go to people. They don't come to me.
Okay, great. Well, we have just a minute left, and we covered so much information. I want to thank you again. It's Marlene Lieberman. She's with Senior Care Planning. They are the solutions for seniors and their families. SeniorCP.com is the website. Her number is 954-806-6035. Give Marlene a call, and she can help you with senior care management. But thank you again for bringing all this wealth of knowledge on the program. You're always welcome to come back on, and we'd love to have you on.
Thank you. Pleasure.
Thank you, South Florida, and we'll see you next time.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life.
The opinions expressed